Thank you all for joining us this evening for our presentation, Closing the Divide, Leveraging Technology to Enhance Patient Outcomes. Here is our agenda for the evening and our learning outcomes. By the end of this course, we hope that you will be able to summarize current healthcare challenges and how they impact patient outcomes, that you will be able to describe technology-driven solutions to address current challenges, that we will give you strategies that can be applied and utilized to advocate for best practices, and that the information provided this evening will help you identify tools in your current practice that enhance your outcomes. A couple of housekeeping items before we get started. This course is eligible for 0.1 intermediate ASHA CEUs or 1 PDH. If you are wanting to obtain CEUs from ASHA, you must be present for the entire duration of this course, and then we ask that you complete a survey within 7 days of course conclusion. So today is Thursday, so by Thursday of next week, we ask that you complete the survey, which we will put into the chat. Additionally, that link will be sent out from a Zoom email account at the conclusion of this course, so it will have the survey link for ASHA CEUs as well as the link to our on-demand webinars, which are complimentary. So this session will be uploaded to our website sometime this evening, so that email will have those links in there for you. Additionally, if you are someone that tracks your own CEUs or you want to certificate of completion for this course, just send us an email at tims-univ@tims.com and we will get that over to you shortly. If you have any questions throughout this presentation, feel free to put them in the chat or put them in the Q&A section. So moving on to introductions, my name is Brooke McGivern. I am a speech language pathologist and a full-time member of the TIMS medical team. I practice in the acute care, inpatient rehab, and outpatient settings and am a part-time graduate school instructor. And with that, I'll pass it over to my colleague, Shannon Marks, to introduce herself.
Hi, everybody. My name is Shannon Marks. I'm also a speech pathologist, and I'm one of the training and demonstration managers for TIMS Medical. So I work with a lot of our West Coast customers. So I help the sales team with demonstrations for prospective customers and also help with training for places that are getting their new TIMS unit.
Awesome. And before we get started, I'm going to go ahead and pop that survey into the chat so that you'll have access to that. Our disclosures for this evening, Shannon and I obviously both work for TIMS Medical. Additionally, I receive a salary from Mercy Medical Center and Maryville University, and we did want to note that this course will discuss solutions from TIMS Medical. So with that, we're going to go ahead and jump right into our topic for this evening. To kick things off, we wanted to talk about the current challenges that we are all experiencing as healthcare professionals. One of the things that you have probably noticed over the past several years are that we are experiencing a healthcare professional shortage, and this is happening globally. So, of course, this is kind of a cyclical situation, which can be caused by the following issues, as well as can lead to the following issues, including poor working conditions, barriers to training and education, job satisfaction, burnouts, issues with salaries, difficulty with work-life balance, productivity requirements, and challenges in the provision of care and more. So again, you all as healthcare professionals yourself can probably attest to having experienced one or more of these aspects, which of course we all can agree can lead to healthcare professional shortages and be impacted by these shortages. So we are going to focus on a couple of areas this evening in terms of the ramifications of the shortage of healthcare professionals. We know that these shortages can increase our workloads for those of us who are still actively working in the healthcare setting. A lack of support amongst the team can increase our workloads. This in turn can diminish patient safety if we have less support and we have less team members. This can impact our ability to focus on what we are doing and take the time needed to ensure patient safety aspects are covered. Additionally, we may have less people to bounce ideas off of and collaborate with. This can further impact our quality of life as we are experiencing these increased workloads, difficulty with work-life balance, as well as potentially a lack of support. And then, as I already mentioned, this can lead to challenges in collaboration and mentorship. If we have less support amongst the team and less team members, we may not be able to help provide mentorship for new graduates or new clinicians or take on students who are in their externship experiences. Diving a little bit further into these topics, as we know, if there are fewer mentors there, then we will experience diminished learning. As healthcare professional shortages continue, this negatively impacts access to education. If we have fewer experienced professionals within the field, we have fewer professionals to mentor students as well as new graduates. Additionally, even if we do have highly qualified and experienced clinicians practicing in the field, if they don't have access to the support they need amongst their team, they may not be able to provide high quality learning for the students or new clinicians that they are preparing to mentor. Additionally, if you are, working at all in the graduate school arena or new grads, you may be able to attest to this, but finding externships for students who are interested in pursuing roles within the hospital can be challenging due to a lack of mentor and availability amongst teams who are experiencing high productivity demands and lower support. This, of course, impacts our foundational learning for the future field of speech-language pathology. Additionally, students may have less hands-on experience, which of course impacts their exposure and readiness to practice. In turn, all of these things impact our graduates' feelings of confidence and readiness to enter the field and can hinder their skills to handle real-world challenges. When we consider how these issues impact us as healthcare professionals, you may again be able to attest that these situations can lead to burnout and moral injury. As you know, we face difficult situations daily, which can lead to not only moral injury, but affecting our overall well-being and job satisfaction. Witnessing suffering can cause burnout, which can in turn impact our emotional exhaustion and lead to detachment. Additionally, we can often face ethical dilemmas and constraints, which leads to moral distress as well as conflict with our values. If we don't have support and we don't have access to tools and resources to help solve problems, these can lead to conflicts with our morals. And then, of course, chronic stress can lead to a reduction in empathy levels, which impacts our patient relationships as well as our own relationships in our personal lives. So as we already alluded to, all of these things can impact patient outcomes. We see in the literature that healthcare worker shortages, clinical workflows, issues with training and education, and burnout directly impact patient outcomes and patient safeties. When we experience healthcare professional shortages, this can impact patient wait times, including access to medical providers, as well as determining diagnosis and treatment and procedures. In addition, if we are experiencing understaffing, burnout, and issues in training and education, we may see trends in the increase of percentages of mistakes made. My mom is a nurse, actually, and she's in nursing leadership, and she and I were just talking about 2 weeks ago when Shannon and I were preparing for this presentation, and she was telling me how within the hospital system she works in, they've noticed over the past 2 years a steady increase in errors in the nursing side of things for a variety of reasons, one of which being high turnover and low staffing. So this is definitely not just isolated to speech language pathologists, but this is happening across the board. And of course, as we already mentioned, we know that research indicates that patient safety can be negatively impacted by all of these topics: burnout, work-life balance, and organizational factors. So we've talked about several issues that we can experience as healthcare professionals, and Shannon and I and the TIMS team want to note that we realize that as a whole, we really need to address the root causes of these issues, and systemic solutions are needed. Number one, a reduction in workload. So how are we as speech pathologists may not necessarily be able to reduce our workload tomorrow, but one of the things that we can do is implement strategies to reduce our workload. Examples include task shifting and improved efficiency, and Shannon and I will discuss this a little bit more later on in this presentation. Next, we want to highlight the importance of increasing support. So, are we able to increase the emotional and mental health support within the healthcare field? Resources and counseling obviously can help improve our well-being. So how can we, foster environments to create these systems within our own organizations? And then last but certainly not least is the ability to improve our compensation. We know that increased salaries and benefits help to not only attract but retain talent, and fair compensation is vital for job satisfaction. I'm sure all of us can probably relate that at some point in our career, we may have been provided with a salary that we did not feel was in alignment with the value that we bring as speech language pathologists. So I know I've talked about this on other presentations that we've done through Tim's Medical, but some of the Tim's Medical leadership team have met with members of the team at ASHA to discuss how we can help advocate for improved compensation nationwide here in the United States by increasing the level at which we are practicing. So that is one of the things that we're actively doing here at Tim's, is trying to help advocate for those things behind the scenes, but also making access to gold standard tools, which we will discuss later in this presentation, more readily available and easy to implement. So a couple of notes on improving patient safety. How do we do this? How can we improve patient safety with where we're at today? I already mentioned clinical workflows, but we know that good patient safety practices are influenced by how organized our workflows are, and not only the organization, but also the ability for healthcare professionals to have autonomy. I think we can all agree that although we do like organization and standardization, it's also beneficial for us to have autonomy as individuals and to be able to work with our patients to determine their values and goals. So by streamlining our workflows and generating autonomy, we can help improve patient safety. Additionally, we've already talked pretty extensively about training and education, but we know that technology can be leveraged to improve training and education, not only for discussion on things such as infection prevention, gold standard implementation of evaluations and therapeutic interventions, but also self-care aspects for us as healthcare professionals, such as sleep hygiene, training to reduce our overall fatigue. And then, as I mentioned, how can we improve our working environment? So a couple of ideas include assessing the working hours of our team, improving work schedules if possible, and reducing hospital crowding through systemic improvement of patient flow and management. So some of these things obviously are just more about us as healthcare professionals talking within our team to determine the hours we're working, how do we improve our schedules. But then in terms of reducing hospital crowding and patient flow, we can look to technology to help leverage technology to improve our efficiency. Organizational climate additionally can be improved by increasing interdisciplinary relationships and assessing our human resource management. So as I mentioned, we've discussed numerous issues as well as potential solutions, but how does technology come into play, and what can I do at work tomorrow? So you probably attended this webinar to learn how you can leverage technology to bridge the gap. As I mentioned at the beginning of this presentation, our hope is that you will take home some ideas and tools that you can implement tomorrow at work. So kind of diving into this, just a quick overview. With the improvements in technology over the past several years, we now have increased accessibility to equipment. So by this, we are referring to improvements in endoscopic equipment, which is still very high resolution, but at a lower price point. Additionally, other tools within our therapeutic tool set continue to become more accessible and more affordable. In addition to this, we know that education, supervision, mentorship, and collaboration are crucial. And with improvements in technology, we now have easier access to improving each of these things. So improving mentorship, even if it's remote, as well as supervision and collaboration within our speech pathology team, as well as the larger interdisciplinary team. This touches on technology and education as well to provide remote educational opportunities. In terms of workflow, as I just mentioned, we can increase patient throughput with technological advances, which we will discuss in a couple of minutes, and then improving access to standardization and reducing workflow burden with increased efficiency. And then last but not least, improving our patient access to information. We know that we want patients to be able to make informed decisions, and by improving their access to their own medical records, we can help empower them to better understand their diagnosis, better understand the plan of care, and really empower them to make decisions with all of the information necessary. So with that, I'm going to go ahead and hand it over to Shannon, as she's going to dive a little bit more into some of these solutions. Shannon?
Thanks, Brooke. So the next couple slides, we are going to be discussing some specific examples of how technological advancements can improve some of those challenges in the healthcare system that we have just discussed. So first, we're going to talk about improvements in technology that have allowed for the creation of more portable scopes. So one type of scope that is generally more portable are the disposable scopes. So they usually will have a smaller monitor, a tablet that connects to the scopes. And so you can see in the picture, we've got the Ambu tablet that's sitting on the Tim's cart there. You can also have the Ambu tablet mounted on the IV pole behind the Tim's cart. And so this allows for the Ambu scopes to interface through the TIM software to be able to utilize the software tools live during the recording, as well as the post-study analysis tools. USB scopes are also highly portable. The newer distal chip technology has allowed for high resolution imagery while still maintaining that smaller footprint. And for example, you can actually have the TIM software downloaded on a laptop and then have the USB scope plugged into the laptop, and that can be your full setup. So this is really great if you are maybe a therapist who covers inpatient and outpatient and perhaps needs to travel with your fees equipment, or maybe you're a mobile fees provider and you drive around to different buildings. So having this portability is really great for a variety of different settings. And something that we're going to dive into deeper in some later slides is the advancements in software that have been able to help improve efficiency for that post-study analysis and reporting, as well as being able to archive imagery. And so these advancements in technology have been able to help create more portable solutions like we've just been discussing, but then also helping to decrease the cost of purchasing fees equipment. And by having a decreased cost of starting a fees program, it helps to then reduce that cost being put on the customer, ultimately increasing the accessibility of getting fees equipment, and then in the end, our patients being able to better access these instrumental swallow studies. Next, we're going to talk about how TIMS review can help with increasing patient throughput. So being able to see patients faster, being able to see more patients in a day. So you can see here in the visualization, we have kind of the typical workflow for TIMS review, where you will record the study, whether it's MBS or fees, on the acquisition device. Then when the study is completed, you send that to your TIMS review workstation. So maybe somewhere in the speech therapy office, or where you do a lot of your documentation. You can do your analysis and report on the TIMS review, and then send the imagery to PACS, and then be able to integrate with your EMR. So I want to kind of talk about this in what it looks like in the lens of an MBS study specifically, and a fees specifically. So for MBS to start, so let's say you're down in the fluoro suite performing your MBS study. So as soon as the study is over, you can clean up and send your study off to TIMS review. So the fluoro schedule doesn't have to provide any extra time to block off the room for you to do your analysis. Or I know like there's some teams I've heard where they will maybe like go back down over lunchtime. So the fluoro schedule is able to really have a more condensed schedule for just performing the exam, and then you can leave and do your review on TIMS review. So this is really helpful for being able to then have the fluoro schedule to be able to see more patients in a day. And then for the fees example, so let's say you have a team of multiple SLPs who, each have a fees study for a patient that day. So the first SLP does their fees study, Again, as soon as they're done the study, they can send it over to TIMS review, and then they can pass off the fees cart or the fees acquisition device to the next therapist to do their next fees study with that patient. So again, you don't need to kind of schedule any extra time on the actual cart. You're able to then see more patients, see more fees studies in a day because you have those external workstations to do all of your reviewing. And so as we've been discussing tonight, being able to increase patient throughput can help in turn improve our efficiency and then help to decrease the overall workload. TIMS Connect is a newer feature in the TIMS environment. So it allows for someone on a TIMS review workstation to securely remote into a TIMS unit, whether that TIMS unit's being used in radiology for MBS studies, at the bedside for fees, in an endoscopy clinic for ENT or GI, or even in the OR. So it provides two-way video and audio during the exam to provide that in-the-room feel without having to actually physically be there. And so as we mentioned earlier with the healthcare professional shortage, the TIMS Connect is a great solution to provide virtual collaboration and mentorship. And in the next few slides, we're going to talk about some specific cases of sites utilizing TIMS Connect. So I'm going to let this video play because we should have audio if it wants to play for us. Okay.
Try to get that junk out of there. Got complete control of the external iliac vein. Let's make sure there's nothing else in the way down here. These clamps can be a little bit ineffective if you have a lot of tissue in there. So then we anchor our clamp against the inferior portion right here.
All right, so you can see here that we have the remote physician with the headset on is providing virtual support to the physician that's actually in the OR performing surgery. So this is a really great example of how TIMS Connect can be utilized to provide collaboration and mentorship without physically needing to be in the same room. Here's another example of a team utilizing TIMS Connect to support collaboration. So the Midwest is experiencing a shortage of pediatric radiologists. So their radiologist is able to remote into the MBS study while the SLP is performing the MBS study in person. And so not only does the TIMS Connect support collaboration, it also can help decrease the workload for those pediatric radiologists or anywhere that's experiencing a staffing shortage like this. Because without remote solutions, perhaps these radiologists had really extensive travel and scheduling demands where maybe they were covering multiple hospitals in one network because, again, of that shortage. So with TIMS Connect, it can help reduce that workload that we've been discussing tonight by decreasing those traveling and scheduling demands. And, they could even join back-to-back MBS studies that are happening at different buildings without having to leave their desk. Next, I want to talk about how TIMS Connect can be used for education. So far we've focused mainly on how TIMS Connect is beneficial for collaboration. Dr. Bonnie Martin-Harris is utilizing TIMS Connect at Northwestern University to help provide education to her students who are learning MBS studies. And so TIMS Connect provides a more engaging environment to learn by remoting into live studies compared to maybe just perhaps watching previously recorded videos of the MBS studies. And another way that TIMS Connect can help with gaps in mentorship is to provide remote support for endoscopy when SLPs are completing their competency training for fees. And the remote user of TIMS Connect is even able to control the TIMS software. So if they wanted to like label, take snapshots, take notes, whatever they wanted to use to collaborate with the in-person SLP after the study's done to help discuss their findings, they have full access to the software tools within TIMS. And I also think that TIMS Connect helps improve quality of life of healthcare professionals by increasing the connection we have with other people in our field. And just speaking from my own personal experience in several of the places that I worked previously, I was the only SLP. So at times that could be really hard and feel isolating. So I think TIMS Connect is just a really also great tool for providing a platform to engage with other people in our field and help improve that overall job satisfaction. And here we're going to talk about how advancements in technology has also helped to bring biofeedback capabilities to our field. So here you can see this video of Brooke utilizing the TIMS software tool called Patient View to show how biofeedback can be utilized during treatment sessions. So Patient View allows for an external camera to be placed on the patient or you and the patient during the study or the treatment session. So you can see here in the top left, Brooke is providing external manual manipulation on herself, which then you're able to see the impact on her internal anatomy. So this is really great for patient education to help explain the benefits of manual therapy. Biofeedback can also be used to help train patients to improve accuracy of swallowing exercises, compensatory strategy training, making adjustments. And biofeedback is just really great for providing a more engaging treatment session to help motivate patients to meet their goals. And as mentioned earlier, we're trying to think of ways to help improve the healthcare system. And like I've already mentioned, one of those ways is improving the quality of life for healthcare professionals. And again, in my own personal experience, I know I always felt really fulfilled and satisfied after leaving a therapy session where the patient was really engaged and felt really happy and was seeing progress towards their goals. So I think anything that we can do to help increase patient engagement during therapy is also helping us with our job satisfaction. So I think biofeedback is a great tool to not only help our patients meet their goals, but also help us as professionals.
Pause it, then get into it start. There's the stem on. It just went off. So you guys will see when the stem comes on, you're going to stretch that laryngeal vestibule. Epiglottis has got to move forward. There'll be a bowing of the tongue. There's the stem on. Nice. So it's on for 15 seconds. Now, we can do a swallow, Brooke, the next time it comes on. Swallow when it goes. You just did one by itself. When the stem comes on, I want you to swallow now. Great. And then relax. And the last one, I think if it's enough for you, Brooke, I just want to just relax, don't swallow. Let everybody see the anatomical, kinematic stretch that happens when the stem comes on. We're opening that airway wider. There it is. And we need the patient to swallow and close that.
You're working against resistance then, and so capacity is a way to add like.
Exactly. We're creating resistance with the stem. We're also strengthening that muscle group that do
Apparently.
within MES. Exercise within MES is always a little better than just exercising.
Yeah, that's crazy.
Last one, bro.
Would you ever do it? That's so interesting.
You can do all of those things. Yeah, for sure. Did you already have one?
All right, so here you just saw a video of how visualization during FEES can be used as a biofeedback tool when you're using therapeutic devices or things like AmpCare. So you can see the FEES image was on the TIMS cart behind Brooke there. So this format of biofeedback can be utilized with any other therapeutic devices too, like EMST or IMST. So there's a lot of different ways that you can implement biofeedback with or without the addition of other tools besides the FEES scope. A super simple way to implement biofeedback for an MBS study is to utilize the TIMS monitor or even just the fluoro monitor if you don't have a TIMS unit to, again, have the patient visualize their swallowing during the study and the impact of compensatory strategies. You can also use the patient view tool for MBS studies. So that was that video a couple slides back of Brooke scoping herself, providing that manual manipulation. So you can also use patient view for MBS studies as well. For those of you who are longtime TIMS users, you'll know that the TIMS software has had a lot of significant improvements in the software tools over the years, especially for post-study analysis. One particular advancement that we want to highlight tonight that can help improve efficiency is TIMS Compare. So in the short clip there, you could see that we had a comparison of a FEES and MBS study. So you're able to play both studies simultaneously, side by side, just like you're seeing now. And you can also go frame by frame for both of those videos simultaneously. And you can also take a snapshot. So there's a camera button in the middle there to be able to take a snapshot, which is super helpful for if there's something particularly notable about the difference between the two exams that you want to include in your report. Like maybe in the analysis section of your report, you're discussing the changes that you saw between the two studies, and then you can embed that imagery to help explain your analysis. And so this tool just overall helps provide efficiency by having both studies side by side instead of having, multiple windows, toggling back and forth. Maybe depending upon what your video controls are, you might have to watch the full old study, watch the new one, try to think about what was different, write it down. So it's just a great tool to be able to help speed up that analysis time, particularly for if you have a patient who's had a repeat study. But you can also utilize this tool to compare two series within the same study. So this is like two MBS series side by side here. So you can also utilize this to look at maybe two different dye consistencies side by side, maybe a trial with a compensatory strategy, a trial without a compensatory strategy, see how the patient compares. And again, just providing that efficiency when we're doing our review. We're analyzing the study, developing our treatment plan. Having this side-by-side feature is really helpful for speeding up that overall process. The TIMS software has also had great advancements in objective measures. The TIMS software provides measurement tools for measuring things like the amount of bolus residue, the amount of aspiration, peak hyoid excursion. There's also a timer function to be able to time components like UES duration, time to laryngeal vestibule closure. And for those of you who don't have TIMS, there are some measurement capabilities that you can try in ImageJ as well. And if you're interested in learning more about objective measures, I would highly recommend that you check out the recording of a previous TIMS University session when AmpCare came on for their presentation. About halfway through, Dr. Dummikin provides a tutorial of how he completes his quantitative measures in TIMS. And that's what that bottom photo is there. It's a screenshot from his presentation. And the recording can be found on the TIMS University page under the on-demand learning section. TIMS also has scorecards preloaded in the software for a variety of different FEES and MBS scoring systems. The latest scorecard that's coming to the TIMS software in the future is the Baby BFSS IMP. Our website also has a MBS and FEES analysis page, which provides links to research articles and resources to learn more about each of these different scorecards. So I'd highly encourage you to check that out if you're interested in trying out one of these scorecards, especially if you have never used it before. And utilizing scorecards is another way to help improve our efficiency because once again, they're preloaded within the TIMS software. It's super quick and easy to go through and score the study. And then you have the option you can just copy and paste the scorecard. So there's a copy button right within the TIMS software. And then you can open up your EMR, paste it into a note. Or if you do want to use the embedded reporting tool within TIMS, the scorecards will also automatically populate for you. And in a couple slides, you'll see what that semi-automated reporting tool looks like in TIMS, but this is just another feature that they have added to help improve efficiency for that overall post-study analysis and reporting.
One of the topics that we talked about at the beginning of this presentation was increasing the patient's ability to access their medical imagery to improve their ability to make informed decisions, but additionally, increasing access to imagery improves our interdisciplinary collaboration. So we talk a lot about how TIMS is being used for speech pathologists because that's kind of where TIMS originally began after our work with the military. However, now and today in 2025, TIMS is actually being utilized by teams not only in speech pathology, but also in GI, ENT, and surgery throughout the United States. And the reason that teams are adopting TIMS and standardizing their practices using TIMS is for this reason exactly, to improve interdisciplinary access to medical imagery and to improve patient access to imagery. We know that this can be a barrier not only in the speech pathology realm, but also across all medical disciplines, as we are really trying to improve, like I said, team access to the images as well as patient access to the images. So that is where TIMS can be beneficial to help bridge that gap. So if your team is currently experiencing what we refer to as imaging silos, where, for example, maybe you're having difficulty uploading your FEES studies or getting your FEES images into the patient chart, TIMS can be a solution that can help with that. So that is why, like I mentioned, healthcare professionals in GI, ENT, and surgery are also adopting the use of TIMS because it easily allows us to archive our studies to PACS or VNA, which in turn helps us to reduce repeat imaging and procedures and allows us to assess progress over time. The healthcare team that I am a part of clinically recently added TIMS MVP for our FEES program. And my colleague and I were doing a presentation to our oncology team. And when they heard that we now have the ability to share our FEES images, they were really excited because before we were all kind of in silos, even though they were doing endoscopy and we were as well, it was really difficult to improve team access to those images because of the system that we were previously on. So as a direct result of this, they are actually exploring what it looks like to add TIMS to their practice so that they can actually upload their surveillance scopes, which again would help us reduce the need to repeatedly scope these patients with head and neck cancer. And when we're trying to assess for internal lymphedema, we could potentially actually look at radiation oncology's scopes instead. So just an example of how this can actually be implemented throughout other departments outside of speech pathology. So we're going to transition a little bit into another area of healthcare practice, which includes documentation and communication. So in discussing the topics for this evening, Shannon and I wanted to provide tools that hopefully we all have access to some degree or another. So one of the big topics that always comes up in terms of efficiency is documentation. So a tool that you hopefully have access to or potentially may have access to in the future are smart phrases. I recently, in the past 2 years or so, transitioned from using an EMR that did not have smart phrases over to Epic. And it was definitely a big transition, I would say, and a little bit overwhelming at first just because the EMR I was originally on was very, let's just say old school. And the EMR that I'm using now is Epic. So if you all have ever transitioned over to Epic, you can attest that it's a lot to learn at first. However, now I can say that it's greatly enhanced my documentation in terms of speed as well as the amount of information I'm able to put in because I can leverage the use of smart phrases. So for those of you who don't know what a smart phrase is, maybe if you've never seen one before, it's just basically a shortcut that you're able to put dot and then whatever the title is, and it will auto populate the information that you have set to that dot phrase. So for example, in my clinical practice, I have smart phrases for things such as the bolus framework. I have one for fees, which includes a variety of things, including aspects of vases, which is really cool. I have smart phrases for head and neck cancer, for post-extubation dysphagia, all kinds of things. So these weren't things that I just created overnight per se. I did block out some chunks of time to create these to improve efficiency in the future. But additionally, as I've continued to practice using Epic, what I've done is every time I am typing something that I know that I will frequently type, such as a clinical swallow evaluation, I actually use that to create a smart phrase. So, just something to think about if you're not leveraging smart phrases. It's definitely a great way to increase efficiency. And we always encourage to not reinvent the wheel. Talk with your coworkers and your colleagues or people in SIG 13 or in some of the fees and MBS groups on social media and ask, if there's a hub where people are sharing smart phrases. I will let you all know that we are going to be creating a page on the TIMS website where you can download smart phrases as well as report templates in the future. So that is coming sometime later this year. So stay tuned for that. But in the interim, these are some other solutions that might help with that. Additionally, templates and flow sheets. Again, this is going to be specific to your EMR, but many EMRs do have templates and flow sheets that can help you streamline your documentation and make things a little bit faster, as well as more consistent across the team. As we've discussed, and you all know, healthcare professionals are usually really busy. And so if we are able to standardize within our teams how we are documenting, such as the use of flow sheets, maybe for your clinical swallow eval or your modified barium swallow studies, that can be something consistent that nursing or physicians are seeing, that they know, hey, if Shannon just did a modified barium swallow study for my patient, I'm going to go ahead and look at the flow sheets because I know the information will be in there. So again, just something to think about to help streamline that communication. And then this is something new that the speech pathology team that I work with has been recently using. So I just wanted to mention it because it's been pretty helpful in my opinion. And I don't know if this is just specific to Epic or if this is in other EMRs, but within Epic, there's a summary section at the top part of your note where you can just write a short little sentence or two about a snapshot of what is going on with the patient. So for example, if I just saw a patient with Parkinson's and I did a fees with him, I could put in the results of the fees as well as my next steps for the plan of care. And then if Shannon were following up with him after me, she could easily open his chart and just see that summary at the top. So it just helps the next therapist have a quick overview of what's going on with the patient. And we found it to be pretty beneficial, and it's really helped improve efficiency. In terms of clinical communication, we know that consistent and open communication helps improve patient outcomes and improves interdisciplinary care. So a couple of ways in which we can bolster or support clinical communication include things such as secure chat or iPhones. Of course, not everyone has access to these, but basically they're just HIPAA compliant ways of communicating within the healthcare team. So if your healthcare organization is looking at maybe adding in new solutions to improve communication, such as maybe a new EMR or iPhones, there's actually research behind these tools as to how they help improve interdisciplinary collaboration and patient outcomes. Additionally, we've already touched on this a bit this evening, but the use of PACS or VNA to share medical imagery and videos can be helpful to improve interdisciplinary collaboration and an understanding about what is going on with the patient. And you can also integrate your medical imagery into reports. So for example, if I'm seeing a patient that I maybe think has a recurrence, maybe they're a patient with head and neck cancer and I'm thinking they have a recurrence, or I'm seeing a patient that I believe has nodules or something, I can take a snapshot of that and actually just pop it right into my report in addition to sending it over to PACS or VNA, and then secure chat the physician that I'm wanting to connect with. So I just had a situation like this last weekend when I was covering in the hospital, and I was able to put the image of what I wanted to share with the GI doc in my report and then secure chat that doc and say, hey, the image is in the patient's report. So that way it saves them time. They don't have to go into PACS and wait for the video to load, etc. So as I mentioned, there is actually research about some of these technological advances, including the iPhone In 2016, Farrell conducted a study to assess how the iPhone was integrated by nurses and physicians for improved communication. And what they found was that both nursing and physicians were easily able to implement use of the iPhone for communication, and that they hypothesized it would be leveraged in the future for quick education, information, and to assist with improved workflow processes. They actually, in the study, compared the iPhone significance potentially to the stethoscope. And I can attest that at 2 different hospitals that I've worked at, we had access to iPhones that were HIPAA compliant, and they really were very beneficial in improving efficiency, because you can easily open the patient's chart right there on the spot. Maybe you're waiting for an elevator or something, and you want to do a quick chart review of a new order that came in, or text a doc about a patient status. So again, if your team is looking at improving communication and adding in new technology to help really all healthcare professionals, this might be a solution to look at.
And another way to help improve efficiency is being able to access educational material and resources from your phone while you're on the go, just like Brooke said, throughout the hospitals. So there are many, many speech therapy apps out there, but we wanted to just give you a couple examples of some apps for dysphagia. So the MASA is the Man Assessment of Swallowing Ability, which was designed for bedside swallow evaluations. And now with the app, it can help save you time by scoring and profiling your clinical swallow evaluations. And the Dysphagia Therapy app by Tactus is a pocket reference to help select the treatment plan to address the impairments that you've diagnosed for your patients with dysphagia. And so you have access to information on anatomy, cranial nerves, treatment procedures, patient handouts, all within the palm of your hand. So, just like Brooke kind of mentioned, just overall with the iPhone, having these apps is super helpful in accessing resources anywhere within the hospital without having to go back to your office and log on to a computer.
So we discussed reporting and the importance of streamlining our workflows. One of the ways in which we at TIMS have tried to help improve efficiency in documentation is with our reporting feature that came out last year. This reporting feature is semi-automated. So what I mean by that is, while you're going through and doing your analysis, that if you have TIMS, you're probably already doing, taking snapshots, maybe doing measurements, pointing out anatomical abnormalities, and doing scorecards. TIMS is actually in the background pulling all of that information forward into a report, like you can see here in this video. So, the goal is that by the time this report section in TIMS, you are 80 to 90% of the way complete. So here you can see that the MBS-IMP scoring populated forward, and as did the digest and all of the other scorecards that I did for this study. And then my snapshots are here down at the bottom. So it's just a really nice, efficient way to complete your reporting, and we can integrate with any EMR. So if you have TIMS and you'd like to use this, please reach out to us, because we'd be happy to help you integrate this into your EMR. Or perhaps you are happy with how your reporting looks right now in your EMR, but you want various aspects of our reporting in your EMR. You can also reach out to us. Like Shannon mentioned, there's a copy and paste function, so you can easily copy and paste your scorecards, you can copy and paste notes, or you can actually copy and paste your screenshots as well. So just something to think about to improve reporting efficiency. I saw someone in the chat, and I think had a question maybe about standardization or MBS-IMP. So this is a perfect segue into that. Within TIMS, as we mentioned, there are many different tools that you can use for MBS and fees, but one of which many people are using already is the MBS-IMP. So if you are an MBS-IMP certified speech pathologist, if you were not aware of this already, you can actually upload your MBS-IMP scores from TIMS to the Global Swallow Data Registry, which helps aid in current and ongoing research. I believe currently they have over 100,000 studies in this database, which is really incredible. And it does help us as a field, as they are using this research to look at various patient populations and, similarities and differences between them, and this will aid in future publications. So if you upload your study, your MBS IMP study into the database, they will actually populate a report for you. So I'm going to go ahead and click on this so you can see what that looks like. So this is an example of what the MBS IMP report looks like. So again, similar, it's got the scorecard here, and all of the verbiage is specific to MBS IMP. So just another thing to think about if you are looking to streamline your reporting and you are using MBS IMP, it's extremely easy to do this, especially from Tim. So this is a quick video just demonstrating this. You fill out your scorecard. This will loop, so you'll see it again, but you fill out your scorecard and then you just click the little upload button, which is right there at the top part of the screen, right there. And then it'll ask you to log in. The login takes, not very long. I mean, this whole process takes probably less than 2 minutes. I did not actually send in open the site because this was just a hypothetical case, so I didn't want to send faulty information to the database, but you get the gist of how to do this. It's very easy, and like I said, they populate back an MBS IMP specific report.
Next, we're going to talk about a variety of educational opportunities. First, talking about TIMS specifically. So I think I just answered somebody in the chat about some where to get some troubleshooting tips. So the training guide in TIMS is a great place to look. So if you're in the TIMS software in the upper left-hand corner, there's the help menu, and then you click on training guide, and then it will provide pictures and written instructions for how to complete different steps in the TIMS software. We also have training from our TIMS training here. So there's 2 of our other SLPs on the TIMS team, and we provide complimentary training live every week for MBS and fees studies. We also have the 12 to 24 hours of free CEUs through our TIMS University and TIMS users group throughout the year. We do have some options for on-site training as well. And then on our TIMS website, we also have a section for tutorial videos that just gives you a couple minutes of how to do one particular function within the TIMS software. So highly would recommend checking that out as well. And we also encourage you to see if your EMR has any complimentary training courses or certifications to help improve your reporting. So like we've kind of talked about tonight, you can develop smart phrases and templates and flow sheets and way to make your reporting faster. So a lot of EMRs will have trainings to help you, maximize your ability to use the EMR and help increase your efficiency. And we also encourage you to check out the website of any medical equipment or any therapeutic devices that you use, because a lot of the websites will have, training guidelines for how to use it and just general resources for the specific area of speech therapy that the tool is used for. Next, we just want to show a few specific links of some really great resources specifically for speech pathology. So the first one here is the Aspect C from Dr. Steele's website. So there are some really awesome webinars that you can watch and some instruction manuals on how to complete different objective measures using TIMS and without TIMS. So this is a really great website with a lot of content on it. Dr. Curtis's website is also a super great resource to check out information for cough, swallowing, voice. So there's some tutorials, videos, lots of resources on here. And the TIMS University webinar page has all of the recordings of our previous sessions. Like I mentioned earlier, the AMP Care presentations on here for objective measures, but you can also see all the previous recordings from last year. And finally, we have a section on the website for advocacy materials. And so there's different mediums on this website. So for like looking at research articles or listening to podcasts. So it's a really great thing too, if you just kind of want to learn more information about MBS or fees or both. There's a lot of great information on here as well.
So in conclusion, we understand that the healthcare system continues to increase in complexity, and we hope that technology will become a vital tool that healthcare professionals can leverage to help maximize our efficiency and improve our patient outcome. In wrapping up this presentation, we identified that we really need to focus on rebuilding our foundation so that we can invest in the future of healthcare. So that begins with education, which is why at Tim's Medical, we are committed to the provision of accessible education, which, like Shannon mentioned, we will have on average 12 to 24 hours of free education every year. Additionally, in terms of well-being, we hope that presentations like this and the support of collaboration and connections amongst healthcare professionals can help us foster supportive environments that improve our well-being across the board. And then finally, innovation. As medical complexity increases, innovation is crucial for continued and improved success. Tim's MVP and Tim's review was actually created based off of healthcare professional feedback to the Tim's medical team. So if you are a Tim's user, or even if you're not a Tim's user, but you have ideas about technological innovations and ways in which that Tim's could potentially be improved, please reach out to us, because our engineering team does take those recommendations into consideration, which, like I said, is how Tim's was developed into what it is today. And with that, we just want to close with a call to action that all of us here together on this call tonight are obviously very committed to improving our understanding about dysphagia and improving patient outcomes. So we hope that this has helped us all just feel empowered to educate and equip other healthcare professionals with some of the information provided this evening, that we can all work towards improving our infrastructure by increasing our support within our environments to promote patient safety, collaboration, and education. And then, of course, we always strive for continuous improvement, including an ongoing evaluation of our protocols and practices. So with that, we'll open up the floor for comments and questions. I know someone commented and asked if they can have access to these slides. We are happy to provide the slides. They won't be on an email from Zoom, but we can definitely upload them to our website. Or if you'd like us to email you a copy, just email us at tims-univ@tims.com. I'll go ahead and stop sharing so I can see if there's any questions in the chat. Let's see. So Melanie asked, how long is the typical archiving for fluoro studies? I use MBS-IMP protocol. So archiving through Tim's is very fast. Like, we're talking less than a couple of minutes. For example, when I do fees and I archive, usually before I'm even done explaining the results to the patient, it's already sent over to Tim's review or PACS, whichever one I'm sending to. So it's really fast, which is why a lot of healthcare teams, specifically in MBS, because we get this question a lot, what other options are there outside of Tim's? Tim's really is one of the only options on the market, because it's become the gold standard. We're able to compress our fluoro studies with Tim's, which helps with that archiving process, and it helps from a storage and IT standpoint. And you mentioned that you use MBS-IMP protocol. There is protocol mode within Tim's, which we didn't talk about, but we should have talked about, because protocol mode can help improve efficiency when you are conducting your MBS or fees study. So there is protocol mode, which can be used to implement MBS-IMP in addition to the MBS-IMP scorecard. Jeanette asked, with all the new technology and AI, do you think that there may be situations in the future where AI would analyze and create a report? That's a great question. And they covered this topic at Meet the Masters at ASHA, I think 2 years ago, and just kind of explored what the future of AI looks like. I can definitely tell you that within Tim's and some of the collaborations that we have with some of the research labs throughout the country, we are looking at some AI components to add potentially to Tim's in the future. So stay tuned for that. And I know many labs are working on AI components. I think at this point, from what I've seen, I don't think there would be a time where AI would totally create recommendations in a report without us. We would, from what I've seen from current data and research that's going on, a human is still needed to double check the work of AI, even if AI is given, for example, like a specific thing to look for. Like, let's say it's looking for incomplete LVC or something like that. From what I've seen so far, humans are still needed to go back over the work of AI. So at this point, I don't think that AI is going to create and analyze a study and create a report without us, but I could definitely see in the future AI being leveraged to improve our efficiency, as it can help us just analyze and create a report faster. Like we already mentioned within TIMS, even at the moment, in its current rendition, it does have that semi-automated reporting where it's just pulling forward all of the work that you're already done. That way you're not having to retype something out. I know before TIMS had that reporting feature, I was handwriting things down because of the EMR system I was using as well, and then having to go up and type it. So the notes function is extremely efficient in TIMS. And then Melanie said, thank you. We are getting a new fluoro system in TIMS. Excited to use this and improve efficiency, quality, and communication. Amazing. Let us know if you have questions, Melanie. And super excited to hear your feedback on TIMS. I know people have been asking what's next in TIMS, and like Shannon mentioned, baby IMP will be in TIMS in this next version, and then we also have several other scorecards and analysis methods that are coming. I don't want to announce them yet, just because I don't know if we're allowed to yet, but Shannon and I were just talking offline about how it's going to be like Christmas for speech pathologists when TIMS 5.3 comes out, because there are so many tools that are going to be in there. So if you already have TIMS, all you'll have to do is just update your TIMS if you're under support, and you'll have access to all of those things. But like I mentioned, later this year, we will have a page on our website which will allow you to download reports and scorecards that people have donated. So with that, does anybody have any other questions? Or Shannon, do you have any other comments?
No, I think we're good. I answered a couple in the chat while you were talking. So we should be good to go.
Wonderful. Well, just in closing, we want to thank you all for being with us this evening. And as always, if you have questions, feel free to email us. The survey link for ASHA CEUs is in the chat, but it will also be out via Zoom in a couple of hours, and this replay will be available on our website. Thank you all very much for being here, and we will see you later.
Thanks, everybody.